Schizophrenia is a complex brain disorder that can profoundly affect a person's thoughts, feelings, and behaviors. Recognizing its early signs is incredibly important, not just for the individual, but for their families and support networks. This understanding can pave the way for timely intervention and better outcomes. It's a chronic mental health condition that alters how a person perceives reality. It can lead to a combination of hallucinations, delusions, and disordered thinking. While often misunderstood, it is a treatable condition, and many people live fulfilling lives with proper support. Identifying schizophrenia in its earliest stages, often called the prodromal phase, is crucial. Early intervention can significantly improve long-term prognosis. It can help manage symptoms, reduce their severity, and prevent the disorder from disrupting a person's life as much. The onset of schizophrenia typically occurs during late adolescence to early adulthood, though it can vary by gender and individual. Males. Symptoms often begin between ages 15 and 25. Females. Onset is slightly later, often between ages 25 and 35. Childhood onset schizophrenia, COS. Rare but possible before age 13, with more severe developmental impairment. Late onset schizophrenia. Onset after age 45, often with more paranoid features and fewer negative symptoms. Genetics plays a major role in schizophrenia, although it's not the only factor. Having a first-degree relative, parent, sibling, with schizophrenia increases risk to 10–15%. Identical twins show a 40–50% concordance rate, while fraternal twins have a 10–15% rate. Genome-wide association studies, GWAs, have identified multiple genes, including those involved in dopamine regulation, e.g. DRD2, glutamate signaling, immune system function, e.g. MHC region on chromosome 6. However, no single gene causes schizophrenia. It's polygenic and multifactorial. One of the first indicators can be subtle shifts in how someone thinks or perceives the world. They might express unusual or bizarre ideas that seem out of character. There might be difficulty concentrating, or their thoughts may appear disorganized and hard to follow. They may also experience changes in their senses, like hearing faint whispers or seeing fleeting shadows that others do not. These experiences can be very distressing and confusing for the individual. Noticeable changes in mood and behavior are also common. A person might become withdrawn, losing interest in activities they once enjoyed, or isolating themselves from friends and family. They may seem unusually irritable, anxious, or experience sudden, unexplained mood swings. Their personal hygiene might decline, or they might develop unusual mannerisms. These changes are often gradual, making them difficult to pinpoint initially. A significant early sign can be a noticeable decline in a person's ability to function in daily life. This might manifest as a drop in academic performance or difficulty maintaining employment. They may struggle with responsibilities or lose motivation for everyday tasks. This decline is not due to laziness, but rather a symptom of the underlying changes occurring. It can be a source of frustration for both the individual and their loved ones. It is vital to remember that experiencing one or two of these signs does not automatically mean schizophrenia. Many conditions can present with similar symptoms. However, if you or someone you know is experiencing several of these changes persistently, it is crucial to seek professional help. Early consultation with a doctor or mental health professional is the best course of action. They can provide an accurate assessment, offer support, and guide you toward appropriate resources and treatment options. Remember, you are not alone in this journey.